name is Jessica Dunbar, and I'm a veterinarian at Littleton Equine Medical Center. And one of the things I enjoy doing and spend a lot of my days doing is dentistry in horses. It's important for every horse. And what I'd love to just talk about the 4 essentials of a good dental exam. There's 4 that you need all of. So sedation is one important thing. Mouth speculum, which you'll see me put on Lizzie in just a moment. That's so that we can open her mouth. That's number 2. Number 3 is going to be the dental mirror, so that I can look at every tooth on the chewing surface. And then the last thing is a bright light. So I have a light that is as bright as the sun. I've blinded plenty of people with it. So those 4 things, sedation, mouth speculum, dental mirror, and bright light, are just essentials. And then Lizzie's getting sleepy here, so she's takes about 5 minutes to take full effect. And then the float itself takes, 10 to 15 minutes. And what we're doing is, with a good exam, but my goal is to have every horse have a comfortable and functional mouth. So I'm going to be reducing any points that she might have, sharp enamel points. And horses form points because their teeth continually erupt throughout life. So they'll start off with cheek teeth, the molars that are about this big, and then they just continually kind of erupt or grow into the mouth as the years go by. And they wear them down chewing hay or grass, forage, and they wear them down unevenly, so they end up with some points on the periphery, and those points can cause some trauma to the cheeks or the tongue, and it's my job to keep those mouths comfortable. So, thoroughbred that has been on the track, or a quarter horse for that matter, will have a lip tattoo like this. And thoroughbreds are going to start with a letter, and that letter always correlates with birth year. I'm looking upside down. Is that a Q or a 0 or an O? Oh, it's a Q. Okay, so Q. You can let go. Then it'll be a series of numbers, but the letter correlates with what year they were born in. This system started in 1945 with an A, and it's gone through the alphabet a few times. 1997 is A again, so we can then calculate what year Q would be. I don't know off the top of my head. Watch your toes there. Oh, 1, 2, 3. Okay, so I'm just rinsing all the feed material out of the mouth, and I'll move the tongue for you in a second to hopefully show some of the points. So if you look at the inside edge of these lowers, wait, let me turn it down. Okay. The points are on the inside edge of the lowers along here, and hers are just mild. And outside edge of the uppers, again, mild in her mouth, so we can see what Picasso looks like next. It's interesting though, the points are worse on her lower right than the lower left, but you can at least appreciate all the teeth. Horses are gonna have between 36 and 44 teeth. Am I still on your head? And that depends on if they have wolf teeth, which is something we usually remove in a young horse. She doesn't have any wolf teeth. And then male horses, geldings and stallions, are gonna have canines almost all the time. So this horse, Lizzie standing in front of us, has 36 teeth. So there are many different options for instruments to float teeth with, from hand floats to motorized equipment. So this one is just one option, and I think you can do a good job with any of those, but this one has water irrigation, and then I'll turn the vacuum on to suck away any of the tooth dust and the water, but I really prefer floating with irrigation. So. thing with these other instruments. Wants to be part of this, I think. Just going to open her a little bit more. Lizzie's a perfect patient. So horses stand well when they're sedated, just like they stand and sleep. Find some educational papers for you guys too, just to talk about aging horses by their teeth. Good girl. Common question I get is, why do wild horses not need floats? Well, my answer is they do. they could benefit from floating. There are a few differences though. Horses in the wild are used to eating forage, poor quality roughage, more like 16 hours a day. And I think these horses probably eat as close to wild horses as you can get, except the roughage is a little probably better quality than what wild horses are going to be eating. So, but typically horses that spend a little more time in stalls and eat pelleted feed are going to have more up and down chewing rather than the nice lateral excursion that a wild horse is going to spend 16 hours a day doing. So horses that eat more pelleted feed and get through their good quality roughage in a short time are not spending those many hours doing that lateral excursion. So they develop points a little quicker in horses that have pelleted feed and nice hay diet. The other difference is wild horses aren't going to live as long as the horses that we care for. So not only do I, as a veterinarian, want to pay attention to the points and prevent any of that soft tissue trauma, we're also looking at periodontal disease or gum disease and reducing any overgrowths on the chewing surface, such as a step or waves, which a step is one tooth overgrown, a wave is two or more teeth overgrown. So that's actually the most important part of what we do, is to minimize any of those overgrowths, because that's going to help the teeth have more even wear and last longer. Okay, picture. So sedation is a very important part of the dentistry procedure. It makes it much less stressful for the horse, and it allows us to do a really good exam on a horse that's not moving around. So the whole goal is to have the horse be relaxed during this procedure. The sedative we use, there's several to choose from, but the one I use mostly is dromosadane. it's going to take, we give it IV in the vein, and it's going to take 5 minutes to take full effect, and it lasts, you know, about an hour. The procedure itself is going to be less than 30 minutes, but so they need to still wake up for another half hour after we're done. That means no food, because they always try to eat before they're ready. So I draw back to make sure I get blood, and then I give what I have in the syringe. So the jugular runs, the vein runs right down this groove right here, the jugular groove, to take blood back to the heart. Now it's fine. Okay, so I'm still just getting the food out of the mouth, but there is an interesting thing to see in the back. So basically, anytime there's a problem where a tooth is not erupting normally, the opposing one is going to overgrow. So I'm going to put my light to the side a little bit and tell me if you can see that tall tooth on the top. Yes. Okay, and that's because the one on the lower row of teeth, which you can't see very well, is recessed. So I'll examine that with my dental mirror. Yeah, so just like a dog's toenails, we can only take off so much at once. So several millimeters, I feel comfortable with that, but she does have a very nice underbite here. She's a good girl, but her cheek teeth are quite nice. And minis are notorious for having some dental issues. Pretty common for them to have teeth, twisted 90 degrees in the socket, or extra teeth, or they can have these issues. Okay, he's doing fine, including my legs, but so he's got a spotless packing feed. And I'm just going to clean it out and see if we need to pack it to keep the food out. We've got a busy mouth. Unfortunately, it's really hard to show you in the mouth.
Chili. Yeah, so you don't know what.